everyone, my name is Sohail Miraj, and today I bring you the sixth episode of Change Conversations. It's a series of conversations of change makers who are making a dignified and effective contribution in their communities and are making change possible. Today we have with us Okolo. Okolo, can you introduce yourself and your initiative?
My name is Okolo Ikechukwu. I'm the founder of MySent Health. MySent Health is a social enterprise tackling challenges facing inaccessibility of medical diagnosis in Nigeria. So what we do at MySent Health is we transport our diagnostic equipment down to healthcare providers like the hospitals that have the economic scale, to purchase their own diagnostic equipment. So we transport our diagnostic equipment to them and we carry out diagnosis, issue results, and provide consultation to them. That's what we do at MySent Health.
Okay. If I were to ask you, like, what triggered you to take this initiative? What was the motivation at back to start this initiative?
Yeah, I was a youth corper, a young youth corper, and I was posted to a village in Ikechukwu where I went, and during my service here, my neighbor was having a high blood pressure. So unfortunately for us, we did not know, and she died in the process. So when we got to the general hospital at Ikechukwu, very far from where I'm staying, so we noticed that it is not the blood pressure is the problem, that she's having high blood sugar, and she died in the process. And at that moment, I have this thought conversion that I have to do something. Imagine where I am, that people don't have access to medical diagnosis. Imagine losing my neighbor in the hands of high blood sugar, something that can be diagnosed and start treatment instantly, but I lost her in that process. So that was the conversion I had that made me start MySent Health. So I noticed that where the rural communities in Nigeria, they don't have access to medical diagnosis like the X-ray, the ultrasound scan, and the ECG. And I'm very happy to start MySent Health because since I started MySent Health, we have reached over 11,000 patients in the last 18 months.
It was something that started with family. So, misfortune happened, like somebody died in your family, and that's where it started.
Yes, so someone died. Yes, and it really dealt with me. I felt the pain of other families not having access to medical diagnosis and losing their loved ones.
It actually helped you to feel it for the other people, actually. Is that right?
Yes, definitely.
What are some of the success stories, like, if you have to share, like, about your initiative, how many people you've been able to impact and all, how many diagnostic centers you've been able to offer or to start and all, what is the process that,
One of the happiest success stories we are having here is healthcare providers. Most healthcare providers that will go to their hospitals and their clinics to have this medical diagnosis, they give us success stories. Like last week, Thursday, we went to a Mopelola Trado Medical Clinic and we conducted scan. On Friday, a woman gave birth. It's part of the success story that we share every day on our pages, that diagnosis is the eye of modern medicine. And without diagnosis, healthcare providers, they will resort to empirical treatment and syndromic treatment. But our success story is the everyday impact we keep making, the lives we keep saving, and the healthcare providers that we keep reaching to that make their patients grow well, do well, and have much healthier people and healthier community. That's our success story. So
what I'm trying to understand, and like what I got from all of this, like, you're trying to indicate and put like a spotlight of like on the unavailability of mechanism of diagnosis in your country, and at the same time you're working to fill this vacuum and all. So what were some of the big challenges that you faced or your initiative faced initially? What are the different bottlenecks that are in your way?
Every business, every initiative has its own challenge, no matter what. So one of the big challenges we are facing is road network, because our main target is the rural communities, people in the rural communities. And due to bad governance in Nigeria, everybody knows my country, bad governance is a major problem we are facing here. So due to bad governance in my country, most of these rural communities, there is no road network at all. So sometimes we experience a breakdown of our van. We experience, a lot of hoodlums on the way, piffery and all that stuff. So the major challenges we are facing as an initiative is road bad network. And another challenge we are facing is our government officials, they are not supportive. They saw the good work we are doing, but they still want us to be the one to do the major work while they take the glory, which, corruption can be a disaster in a nation. And that's what's happening to us in Nigeria here. So we are trying to tackle these two major challenges by promoting the way that's what we do now. We are currently doing what we call universal threshold. So we are trying to place a lot of ultrasound machine in so many communities. So we don't have to be traveling with them. So we want to buy more and put in a lot of communities so that once we go, we do the scan and give them a report instantly.
Okay. What are the different ways that you have discovered, like recently, or you are like planning, or you have to meet this challenge? Like you talked about, like this, like roads are like some of the big bottlenecks, and that is kind of like clogging your way for you to reach out to the people. So how are you like planning or reaching out to the people at present?
Okay, yeah, due to the challenges we are having, due to the road network problem we are having, we are trying so much to have what we call universal network. Universal network is universal health coverage in Ikorodu. We have 6 LCDAs in Ikorodu. So we want to have a one-stop diagnostic center in each of the CDAs, so that each diagnostic center will serve all the LCDAs. One LCDA have one diagnostic center, so that we can overcome the challenges of bad road network. Because sometimes the bad road network stops us from reaching to where we want to go, maybe because of breakdown of van or because of unavailability of staff, So, but now we are tackling it by trying to create a one-stop diagnostic center in each LCDAs in Ikorodu.
Right. So, I mean, how is the overall journey like? How do you feel when you see, like, all your initiative is impacting people, it's creating a viable change, and it's impacting people's lives, and you're seeing that it's happening. The big thing is, like, you're there and you're able to see the impact. It's really helping people and easing their lives and saving many lives. So how do you feel as an individual, when you see this year of initiative is helping people to rediscover new ways and helping them to live?
The best word to use is fulfillment. If you are making impact, and you are, like I told you, our success stories is, we see it every day. People give success stories every day. The impact you are making is our success story. I feel fulfilled as a person. When I look at when I started, when I lost my neighbor that initiated me to start my Sense Health, looking at 18 months now, we have impacted in 11,000 people. And looking at on Friday, someone gave birth due to our impact, I'm fulfilled. I look at myself and I'm proud of myself. I don't need anybody to be proud of me, but me personally, I'm very proud of myself and I'm fulfilled. So that's how I feel.
So if I were to ask you, like, Okolo, where do you see your initiative down 5 years? What are the different plans? What are different target groups? Are you planning to extend it up to the different parts of Africa? Will it be a Pan-Africa initiative? What is that it will look after 5 years? And what are the different increments that you will add to your initiative?
Yeah, in 5 years, to be candid, to be truthful with you, Nigeria is a big market. Nigeria is a very big market. So we have 36 states in Nigeria, and we are still in 2 states. We are still in Lagos State and Ogun State. So we have 34 more states to go. So in 5 years, I see us covering at least 10 to 12 states. I see us expanding, not to other African countries for now, but at least let us conquer Nigeria as a country. Let us have our market value, high market value in Nigeria. They say think global, but win local. So I want to win local first. before things going beyond Nigeria. So in next 5 years, we have a lot of states, 34 states to cover more. We are in 2 already, and we have 36. So in next 5 years, I see us covering the southwestern part of Nigeria, heading to the southeastern part of Nigeria in 5 years.
Okay, all right. So what will be your message to the youth of world?
My message to the youth is humanity first. If you want to get far, solve a problem. There are a lot of problems around us. In all the sustainability goals, there are a lot of problems that not just me, not just you, is for everybody. So my words to the youth is,
it was really a delight and honor to have you, Okolo, today. It's people like you who are adding meaning to this world, and and are trying to help us build this world more undivided for everybody. Change makers like you are, putting vision to the true desires and true dreams of every individual. People like who have no access to the modern means of communication. They have no idea what sustainability it is. But you are the real change maker. You are the one who's getting them close, to this idea, and making the idea of sustainability and why it is important for people to abide by it, and the governments itself, because you are in itself creating an atmosphere of government in itself to adjust a model of sustainability in their paradigm. It was a real.
Yeah. That's why we have to be the problem solvers, not the problem creators. Everybody sits back and complain, while some of us are solving the problems around us. And that's why I urge everybody to do, instead of sitting down to complain, why can't you solve a particular problem around you?
It was really a delight and honor, Okolo, to hear from you, and we wish you all the best with your endeavors, and we expect you that you keep doing this great work, and just wishing you all the best, and thank you so much for being with us today. Thank you so much.
Thank you.